What is psoriasis? Well, psoriasis is a chronic skin condition where the immune system makes a mistake and tells the skin to make too much skin in pretty typical areas. And that results in scaly plaques on the body that can sometimes be itchy and uncomfortable. But one of the important pieces in terms of psoriasis is genetics. So psoriasis tends to run in families, and so especially if you're a younger child who's diagnosed with psoriasis, you're more likely to have a parent or a family member who also has psoriasis. Who is most affected by psoriasis is adults. So it's most commonly diagnosed in adults, and there's a peak time where we see it between the ages of 15 and 30, and also 50 and 60. But the truth is, we also see psoriasis in children and even infants, so anyone can get it. So how psoriasis is typically diagnosed in patients is the appearance or look of the rash. So there are these scaly plaques that tend to occur in fairly predictable areas. That often looks red and scaly in patients with light or white skin. In patients with pigmented or darker skin, that redness isn't as apparent and actually presents with different colors. It can be gray, ashy, more purple, more hyperpigmented or brown. And that, because that isn't always represented in how we teach psoriasis appearances for healthcare practitioners to recognize, that can lead to a misdiagnosis. So really that intensity of color can be different, and how the psoriasis presents in different areas can also be different in patients with skin of color. So it's really important that both healthcare providers but also patients are empowered with the knowledge to know how psoriasis can look different. Some people wonder whether you can outgrow psoriasis or if psoriasis can go away forever. And the answer is we don't know for sure in every patient. Certainly there are some children who can outgrow psoriasis, but the older you are when you develop it, the more likely that you may have it persist for life, or at least the vulnerability to having flares of it. It is possible to achieve long periods where you don't have any psoriasis with treatment, but we assume that if you have psoriasis diagnosed, that it is something that you may have to deal with long-term as a chronic condition. Psoriasis can have big impacts on mental health and self-esteem. We know that it's associated with depression and anxiety, and can be quite stigmatizing for patients and have a profound effect on patients' quality of life. What can they do in terms of lifestyle changes to improve or help their psoriasis? And there are many. The first is to concentrate on skin health, to make sure that you're moisturizing regularly and doing all the important things in terms of maintaining your skin barrier. The other thing is, if you are a smoker, stopping smoking can really help improve your psoriasis. Making healthy nutritional choices can also be helpful. And these are all things that we can do to improve our overall health, but also help to manage our psoriasis. So there are many treatment options available for psoriasis, and it really depends on the severity of the psoriasis that a patient has. Good skin health and taking care of the skin as a skin barrier is always the foundation. And then there are prescription topical creams that can be used, phototherapy, which is like a type of medical sun tanning, as well as oral medications and even injectable medications to treat the condition.